Good morning. This is Ron Gold from Marketing Works. The name of the show is The NonProfit Voice, and we are lucky enough to have the New Hope Mental Health Counseling Center, Dr. Nicola Beckles, Clinton Clovis, and Don Sinkfield. Welcome.
Thank you.
I'm glad you're here today, and mental health awareness is so major right now. I mean, you can't pick up a newspaper without reading about it. People are talking about it all over the news, and it's a topic that is very scary. It really is. And Clinton, tell me about what you guys do at the New Hope Mental Health Clinic Counseling Service and how you started.
Well, at the New Hope Mental Health Counseling Services, we provide full service outpatient treatment for our clients. We treat clients from as young as 5 years old to 85. We treat clients for ADHD, bipolar, schizophrenia, a range of mental health conditions that you have to deal with every day.
Well, you started in Valley Stream. That was your the first place that you opened, and then recently you've been in Rockville Center. How did you come up with this idea to start this venture?
Well, just for clarity, the New Hope Mental Health Counseling Services is a business, a for-profit organization, and we partner with our the Speak Hope Foundation.
Which is a nonprofit. Thank you for clarifying that.
We started in Valley Stream in 2010, actually. And that year, it was simply myself and a few other counselors doing sessions, and Clinton joined me in 2013, and what we realized very quickly was that we were providing a very needed service. People were calling the phones back to back. We had to go from using mobile lines to getting an advanced phone system so that we could take all of the calls. And the services, as Clinton mentioned, range everything from adjustment disorder, depression, anxiety, all the way to more serious things like schizophrenia, for which we have a person who does medication management when there's more serious treatment needed than the therapy that we provide.
Well, Don, you and Clinton work together. What are your two roles?
Oh, Clinton serves as president. When we started, Clinton was actually at Hunter College becoming a licensed mental health counselor. And he, over the years, provided so much in the way of good service and leadership that I am happily the vice president while Clinton is president.
Now, your backgrounds are both in mental health or social services, and we have Dr. Beckles, who is here. You run the foundation, and we'll get into the foundation later, but what is your background?
So I'm a licensed clinical psychologist, and I have 30 years plus as a school psychologist and clinical psychologist, and I have my own private practice.
So let me ask you a question, because this deals with mental health right now and children's mental health. I mean, this really isn't anything new. It was just that during COVID, when families were together, it stood out more. Am I right in that? I mean, is this something that's been going on for a long time that's not been diagnosed, or they've been diagnosed wrong, or they didn't take the time to get their kids checked out?
So you're correct, Ron. What I have asked my parents when they come in and tell me that their children are exhibiting certain disorders, I ask them, are you seeing this more now, or is it because you're home, or was it always there? And they're telling me it was always there, but they did not realize that it was so severe because during COVID, they spent more time with their children.
Do you think because of the exclusiveness of the families in small areas, and being together as much as they were, even if the parents were having problems with each other, that it wasn't brought to light like it should have been?
Correct.
Yes.
So there was so much distraction going to work, taking the children wherever they had to go. The parental issues were not being addressed.
Now, how are people finding you? I mean, you guys have just opened up, right, in Valley Stream. You've been open in Rockville Center, but you've been open in Valley Stream for a while. How do they find you? Because I think it's so important that they get to you and get the counseling that you provide.
So let me start, and I think Clinton will have something to add to this. When we started in 2010, there was only 10 people listed in Valley Stream as mental health providers on Psychology Today. Today, there's over 40, and we train many of those individuals and groups that function now. So we're proud of that. Mm-hmm. In the beginning, people found us on Psychology Today. We hardly had to advertise in any other way except putting ourselves on Psychology Today, and our phones were going bananas because people needed the services. Today we have a wonderful website. It's the newhopemhcs.com. People find us there. People find us on Psychology Today. People find us through word of mouth, and people find us through the mailings that we do and social media. But as for the walk-in center, I mean, Clinton had a lot to do with creating that model.
Yeah, we have an aggressive social media digital marketing campaign currently in place, and we are reaching out into the community, networking with the various organizations involved in healthcare overall. So that's how we're getting out there.
Tell me about your staff. I mean, if people come in, they walk into your clinics, what happens?
Well, first thing, they walk into the clinic, they're going to find a very homely environment. We pride ourselves in providing culturally competent service. Our services are offered in 6 different languages, right? So including English, you have Spanish, Bengali, Hindi, Urdu, Haitian Creole, and Greek. So when you come in, you're gonna find a clinician that speaks one of these languages, understands your culture, look like you, and is willing to work with you.
How many clinicians do you have, or social service professionals?
We have close to 45 clinicians on staff working with us. And we also have a very healthy, very strong clinical internship program. So we have like about 16 interns that are currently being trained to work in the field of mental health.
Well, I just keep thinking about, is it more children? Are you involved with the schools at all to try to let them know about you? Or do they try to handle it themselves? Yes,
the aim of the walk-in center is for that purpose, because children act up every day. And I learned about a year and a half ago that some teachers are not trained to deal with these disruptive behaviors that children exhibit from time to time in the classroom. So what they do, in their frustration, they direct that child to a different room, or they ignore the child. And that does not help. So the hope is for those schools in the area, that they will learn about us and they can come and get the help that they need.
Yeah, and I would add that Clinton has been an advocate for children personally, mm-hmm. Trying to work directly with school pupil personnel teams to avoid kids being out of school for long-term suspensions. And our therapists, many of them have a background in school counseling, school mm-hmm. psychology, and do much of the same.
Yeah.
Well, I do want to ask you another question that's going to lead to Dr. Beckles, and that is that we're seeing that and you take insurance, that a lot of the co-payments mm-hmm. are too high for people to get their medicine, to get services that you offer. So your new foundation, well, I don't know if it's how new it is, but Dr. Beckles, you run the foundation, and I want you to talk about it. This is a good lead-in for you, because we take the money that you raise, and some of it is used to help with the co-payments. Am I right?
Yes, you are, Ron. So the foundation was started in 2021, so it's fairly new. And what we are trying to do is to offset those hefty co-payments and co-insurances. This way, clients will not trade off buying groceries versus coming in for treatment.
Mm-hmm. Yeah. And it's not just limited to that. I mean, we're seeing co-payments for, for medications that people aren't getting because they don't have the money. It's either, should I get the medication or should I get food?
Correct.
And
Yes.
having somebody like this, is what you're doing is perfect. The timing couldn't be better.
I agree. So I would like to read the mission statement, and that will explain exactly what we're trying to do. The Speak Hope Foundation provides life-changing, affordable, evidence-based services to underserved communities whose members cannot meet the increasing cost of these mental health services. The foundation strives to promote improved mental well-being for all individuals and families through education, supportive services, and advocacy. Mm-hmm. So that is our goal, to raise money now so that in the late spring, summer months, we will be able to provide those services.
Yeah. Well, we recognize April 2021, when the insurances returned patient responsibility back to the patients. They also returned to these patients increased costs in co-payment, co-insurances, and deductibles. And as Dr. Beckles just said, our clients benefited tremendously during the COVID period, and now they are forced to respond to competing obligations, right? So if you have to pay $75 in co-payment when you weren't paying that before, you're talking about $300 a month.
Right. It's not a one-time fee.
And that's a car note, right? That's groceries. So now what we find is that clients are choosing to pay these more needs, right? Their mortgage, their groceries, and they are foregoing treatment. So we are seeing an increase in regressions in the symptoms of bipolar, anxiety, and depression. And it's hurting the community. So the Speak Hope Foundation, Don and I decided we have to do something. We have to be responsive to the needs of the clients that we serve. Mm-hmm.
And I would add that, the need to pay for treatment is not limited to, we talk about the underserved because we care very much about serving the people who we consider underserved. But truly, many of the people that we are helping are people who would be considered middle class. Mm-hmm. They have jobs and they are working, productive people, but they simply don't have the disposable income of $300, $500 a month. If you think about if there's a child needing treatment and the parent needs treatment, that would be 2 copays per month. Let's say if those are $50 copays or $75 copays, it really can be a
strain,
very much a strain on the finances.
Mm-hmm. Well, let me ask you a question, Dr. Beckles, because how do you choose who's you're going to give the money to?
So we would like to have people apply.
Okay.
We need to somehow vet that they are in need, and we haven't discussed what is a good way or what variables to put in. So, for example, a paycheck stub is not enough to say, yes, you can afford, no, you cannot afford. So we really are going to talk with the person. They're going to complete an application, and then we will determine whether or not they're a good fit with the program.
Would you pay part of it instead of the whole thing?
We could consider that, yes.
And this way you can do more?
Yes.
Mm-hmm. Mm-hmm. Now, I have been at the fundraiser that you had, and I was delighted to be there. It was wonderful. Mm-hmm. And that money that you're raising that's what this is going to be used for.
Yes.
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 So you have to do a lot more because there's a lot of people in need.
Exactly. Yes.
Yeah.
And we already had someone petition us for a co-payment reprieve.
Really?
So, yes.
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 So what are your, so you'll be doing a lot more fundraising during the
Absolutely.
coming year.
Absolutely.
And I think the topic is an excellent topic that, you know, you do need to get out there so more and more people know about it. So it's a chicken and egg thing, you know, the more people know about it, the more people that are going to be calling you and trying to get money. And unless you do larger fundraisers raising millions of dollars, you can't take care of everybody.
Yes.
But at least you've started. And I think what you did at the beginning, and I liked what you did where you were honoring the people on the staff at New Hope Mental Health Council. I thought that was really nice.
Yes.
And it gives them a feeling of fulfillment, you know, that they're doing a good job and they're appreciated by the three of you.
Yes.
The recognition. That's very
recognition.
important. Yes.
So who else is on the board?
So Clinton and Don are on the board. We have a secretary and we have the treasurer. And we're looking for a CEO at this point.
For a CEO?
Yes.
Of the,
Of the board.
I thought you were.
No, I'm the chairwoman.
I thought that was the same. No.
No, it's often confused, but the CEO reports to me.
Okay.
Yes.
That is confusing, but
Yeah.
Yes, it can be.
it can be. So what are the goals for New Hope Mental Health Counseling now? Are you going to be opening more satellite offices?
Yes, but my immediate focus is to introduce new counseling options for the community. So right now, I have just put together 3 groups, 12 weeks group for the public. It will be anger management, substance cessation, and seeking safety. So that is what I am looking to roll out in the next couple of days. It'll be done virtually, of course. Virtually tends to reach more people. A lot of people feel more comfortable, and frankly, there isn't much significant difference with in-person and virtual therapy.
Right.
Right. So,
And a lot of the agencies were doing that during the COVID.
Yes.
And the social workers were talking to kids and families, and
Yes.
I'm concentrating more on the kids with this now. And some of the kids had to take the calls, you know, in the bathroom.
Yes.
So that they couldn't talk, you know, about anyone in front of them. And that was hard on them.
Let me say this in my observation. COVID did a lot of good things for a lot of families. Husbands and wives recognize for the first time, for example, hey, we have a problem here. Because going to work for 9 hours a day or 10 hours a day, they weren't forced to be in one space and deal with the challenges in the marriages, right? So we had couples who for the first time recognized, hey, we have a communication problem. You know, I didn't know my wife was doing drugs. A lot of things came out during COVID.
Yes.
So now what we're focusing on through these groups is to have a lot more reach into the communities.
And Don has a podcast. Do you address all these issues during your podcast? How can I find you?
Thank you for asking, Ron. The Help to Adjust podcast is Help to Adjust Counseling on Facebook, on Instagram, Don Sinkfield, or Help to Adjust on LinkedIn and YouTube.
And if anybody wants to reach the New Hope Mental Health Counseling Service, is there a phone number they can call and a website?
Yes. So that phone number is 516-459-2920. They can also get us at info@thenewhopemhcs.com, and our website, one of the best websites I've ever seen, www.thenewhopemhcs.com.
Clinton Clovis, Don Sinkfield, and Dr. Beckles, thank you so much for being on the show today.
Thank you for
you,
having
sir.
us, Ron.